Welcome back to Healthcare Rounds, the podcast for healthcare business leaders, clinicians, patients, and really anyone interested in cutting edge of healthcare policy, technology, research, and business. I'm your host, John Marchica, CEO of Darwin Research Group. I'm very excited today. Our guest is Dr. Robert Pearl. He's a returning guest, so we spoke several years ago. He was CEO of the Permanente Medical Group for nearly 20 years, has been named one of modern healthcare's 50 most influential physician leaders, serves as clinical professor of plastic surgery at Stanford University School of Medicine, host of a top podcast, Fixing Healthcare, which is great. I highly recommend it. I listen to it. One of the very few healthcare podcasts that I listen to because I've got my own, but really enjoy it. Best-selling author of several books, but the one we're going to talk about today is regarding AI and Chat GPT, which is called How AI-Empowered Patients and Doctors Can Take Back Control of American Medicine. So I just want to say welcome, Dr. Pearl. It's wonderful. Thank you for taking time to talk to us. I've been looking forward to this for some time, and very interesting. So thank you. Thank you for being here.
John, it's my pleasure to be with you once again. Looking forward to it.
Now, before we get into the book, talk to me about your initial exposure to Chat GPT, because you had a really interesting anecdote in your newsletter that I'm sure not everybody gets. To just tell me a little about your introductory experiences with Chat GPT.
Well, my first introduction to it was really just to test it and try it out. And it was remarkable to me what it could accomplish. You know, I've been involved in computers really my whole life. I went to Columbia University when I was in high school to take courses in computer science and took jobs during the summer to program. And computers have always been a powerful tool for the user, but they provided predominantly knowledge. And what I experienced in ChatGPT is it provided expertise. It could actually do things for you. You know, I talk about how the tool or a derivative of the tool can allow people to paint like a Rembrandt or compose and write a song like Drake, to be able to actually program computers. And it was very clear to me as I started to use it, that this would revolutionize medicine. It would allow a patient to have expertise, something that simply does not exist, and then quickly could see how that would change the trajectory of medicine, leading to greater health, increased compliance, better relationships between doctors and patients, and really to be, in my viewpoint, in healthcare, what the iPhone has been in the rest of society and in the retail world.
So I want to I've got a bunch of questions here, but I want to home in on something that you said, which is about patients. And I think about today, you know, they're inundated on TV with, I think I have the Skyrizi jingle in my head from it being on TV so much. But when something is wrong, they Google, and they come in maybe to see you, or more likely a primary care doctor. I've got this problem. And, and there's been an issue about, well, the misinformation, right? And where they're getting their sources of information. Are they looking at Medscape? Are they looking at Mayo Clinic newsletters? Probably not, right? And so, but now with the advent of ChatGPT, I've got, try to keep people in my company away from it for market research purposes as much. But I guess what I'm getting to is in a way it can be empowering, and in a way it can introduce more problems. And so what is your feeling about, how patients are going to be learning about their issues if they've got something wrong with them using ChatGPT? Just give me a sense of how the dynamics might change as patients become more involved.
They're going to dramatically change. And I want to stress to viewers and listeners, we're not talking about GPT-4, what's currently available. This technology is doubling in power every year. It's an exponential growth curve. By 5 years from now, it's going to be 30 times as powerful. It would be the equivalent of your car going faster than an airplane 5 years from now. Impossible to imagine but that's the trajectory we're on. And if anything, I think that I under anticipated how fast the changes would happen, not being overly optimistic around it. We could spend a couple of days talking about the different ways, but let me give you 3 examples. The first one is, let's assume it's 11 o'clock at night. You got a young kid. Kid has a fever. What should you do? Do you take the child to the emergency room where you know you're going to wait an hour or two, be surrounded by people coughing, or do you wait till the morning and the risk that child might not be alive if it's a meningococcal infection? You call the doctor's office, and what do you get? Nothing. You get a recorded message that says, go to the ER. It's not designed for you. It's just to
Right.
protect the clinician. You call the answering service and say the doctor will call back in the morning. I don't need the morning. I need information now.
Yep.
Now, is it perfect? Well, they say, not even today is the future one. I'm not saying it's perfect. I just know it's far better than today when we have absolutely nothing available to help that patient. Chronic disease. 70% of Americans have chronic disease. 60% of chronic disease. It's 70% of the cost of American medicine. We're talking about diabetes, hypertension, asthma. These are the things that lead to heart attacks and strokes. Other chronic diseases lead to cancer. So we have a lot of opportunities to be able to change that trajectory. What's the problem? We have wearable devices right now, very excellent ones, high quality ones. The problem is, what do you do with the data?
Right.
Your doctor doesn't want it in the office. It's overwhelming. To you, you're not quite sure how to interpret all of this. I've pushed companies like Apple now for a decade to say, why don't you use what we already have, the knowledge of various AI tools, to tell patients, how are they doing? Well, now you actually don't have to wait for that application. You can put your information, download it into a generative AI tool, and it will tell you how you're doing. And right now, with the introduction of 2 things that OpenAI released, and I keep saying Chat GPT because it flows off the tongue nice and easily. It's no different than Gemini and Claude and a bunch of other applications that are out there.
Sure.
Number one, you want to be able to download that data. We're talking now about plugins. I mean, plug-in is a nice word. It looks like you actually plug it into the machine. You don't. That's obviously Bluetooth generated. But now we call them GPTs. Easy access of data. And the second factor is memory. So now it can remember everything about you. And now you have precision medicine. It can include your lab values, your history, your family history. It can include your entire genetic sequence. And unlike when you go to a Google and click on a link, you get information specific to you. It's actionable. It's expertise. So that's the second example. The third one I talk about in the book, Chat GPT MD, is how do we flip the direction? I allude to the Khan Academy, which is an academic educational place in Santa Clara County, California, where rather than going to class and learning a subject and then going home and doing homework, the night before you actually learn the material at your own pace using a computer tool. So when you go to the class, you can actually have a conversation in great detail. I think the same thing is going to happen with the doctor. You'll have a certain amount of symptoms and problems. You'll get information about it. And then when you understand what the likely diagnosis is, what the likely workup is going to be, what the likely treatments are going to be, you can have a conversation. It's completely different than printing out 100 pages off of Google that the clinician
Right.
won't have to read. And as you say, they have a lot of misinformation. So this is an entire new world, and people have to get rid of their past assumptions about medical care to see what the future beholds.
So, Dr. Pearl, I don't know if you're going to have the answer to this, but one of the things that I'm trying to get my arms around is, clinical decision support tools have been around for a long time. And certainly tools, I'm not in this world, but certainly tools are available in precision medicine to be able to align what particular cocktail or what particular regimen is appropriate for this cancer patient, let's say. What makes the large language models of the Chat GPTs of the world so different in terms of analyzing all of these different disparate, sometimes parts of data and pulling it together to bring to you as a clinician something more accurate or something more all-encompassing? What is it about? And I don't know, maybe it's going to be over my head and the audience's head, but I'm just wondering, because decision support has been around forever. And we've been moving in this direction in medicine, right? Better diagnostic tools for doctors. So what is it about this that's kind of a game changing?
There are different perspectives depending upon if you want to look at the patient or the clinician. For the clinician, you're absolutely right. We've had these tools for a long time, and they're good. The challenge with the tools that have existed is they've been what's called rule-based. In general, it means that a set of clinicians have developed these tools, and therefore they can only be as good as the clinicians themselves, or they've been data set based. We call that narrow AI. So you can take a large group of cancer patients, some of whom get the treatment, some of whom don't, make comparisons within it. And then it's risky because it has a lot of bias in that data. We know from research, as an example, that the care provided to Black patients is not the same as to white patients, and that the assumptions made about outcomes is likely to be wrong because it will make certain decisions based upon the data that's provided about the lack of care given to Black patients. So there's a lot of issues in the past tools that a generative AI tool doesn't have, because it's able to include the totality of the information available in journals, in textbooks, soon taking recordings off of presentations in the healthcare conferences presented today in each specialty and incorporating into the technology. You'll be actually able to learn from how clinicians practice and analyze the outcomes. So it's going to be significantly better for the clinician. But the really important difference is going to be for the patient. All the tools you're mentioning, patients can't access it. No less to say, how do they use it? No less, how do they understand what it all means? You can take this information, you can translate it down to your specific level of expertise. And as I said earlier, you can personalize it. It's not about breast cancer in general. It's a particular kind of breast cancer. It's a particular degree of spread. It's a particular relationship to the rest of your health, to your family history, to your genetics. And now we're talking about what to a human mind would be 10 years of education that we now can compress in terms of a single application available to a patient.
So everything that you're talking about sounds very rosy, right? But I think we think about this in a lot of different aspects. And I'm not talking about the Matrix, or the Terminator movies and computers taking over the world. But what are the dangers specific to medicine, specific to healthcare delivery, and the various applications? I mean, there's just a JAMA article that came out, was it last week, talking about different applications that I had in front of me, and now it's no longer in front of me. But my point being, what are people worried about the misapplication of this technology as it relates to healthcare?
I think it's important to put it into context, which is if you ask about the absolute risks, they're massive. Privacy, security, misinformation, bias. It's a 5-part book. The entire 4th part of Chat GPT MD is about the risks. So I don't want to minimize that to anyone. We just had a situation with Change Healthcare where there was a ransomware attack and a huge amount of data was stolen.
Right.
The issue is, does generative AI make that worse than what exists right now? And my answer is no. And I go through each of these pieces and show why it's actually less risky, because it's a subscription model, $20 a month, about a latte a week, compared to an advertising-based model like a Google search engine might otherwise be. And so I think there's a lot of risks and concerns when it comes to computer technology in general, but I don't think the particular challenges from a technological standpoint is greater. I mean, we have all of our medical information, electronic medical record, and people are trying to hack into it. Does generative AI make it better or worse? I don't think it makes it any worse. So I think the problems are the general problems of modern society. Where I think the biggest issue really is going to come down to is not the technology. It's the humans using it. Will doctors embrace it and be willing to share that power with patients? I'm pretty confident patients will want to use it. Why do I say that? Because they now use Expedia and plan an entire trip with airfare and hotels and restaurants. They use a financial tool to be able to access their information in their investments. They use a tool to go to their banks. They take a picture of a check and send it electronically with the belief that it's going to work. Well, there's a lot of risk behind all of those. And we can assume that the generative AI programmers are really sophisticated and are likely to be just as protected, which is not perfectly protected, but just as protected as what exists today. But will humans use it? And I want to add another piece. Chat GPT MD is really about what we call value-based care. Value-based care is this idea that the way we can lower healthcare costs is by raising quality and making care more convenient.
Sure.
All three parts of that. And as a consequence, patients can do more things and stay healthier, which diminishes the demand on doctors who right now are overwhelmed by the massive amount of work they have to do, with burnout exceeding 60%. And what's the problem in that, as you say, rosy picture? Well, if less is being done by doctors, will they make less money? And that is not crass or problematic. None of us would want to earn less money. And the observation I make in the book, and I talk about 4 generations, healthcare 1.0, 2.0, 3.0, and 4.0, is that those tools that could have added more value were not used and are not being used today because of the negative financial implications. That's why patients are always asked to come to the clinician's office or treated inpatient rather than at home. But if you can shift from payment being transactional, fee for service, the more you do, the more you get paid, whether it adds any value or not, doesn't matter. Do the same thing twice and you get paid twice.
Twice.
This is transformational. Now we're talking about pay for value, value-based care, capitation is the word that I like. And now you're rewarded when you help a patient avoid a heart attack, stroke, or cancer. Now you're rewarded when they do something to be able to avoid the need for medical care. But that's going to require humans to lead the way. And that's why I talk about it being the clinician, dedicated clinicians with empowered patients, combined, supported by a generative AI tool.
We've now arrived at the same point that we kind of arrived in our last conversation around capitation, around the kind of payment models that are going to be required for success in our country, kind of looking long on the long haul. And my initial inclination was thinking about, well, it's a disruptive technology. And you gave the example of the Expedia. We can go right down the list. Uber, right? Amazon, we go down the list of all these disruptive technologies that have changed how we do things. And if this disruptive technology, let me just kind of rephrase what you were saying, is applied in a fee-for-service world, all of the incentives are against really the disruptive technology taking hold, because physicians and other people who get paid in this way are going to be concerned about that. But if we're in the back end, the value-based world, if we're under the Kaiser model, if you will, right? Or something similar to that, where you have total control over the patient and it's more of a capitated per member per month kind of model, then the incentive is all around efficiency in the best possible sense of the word, and where patients can take more control. And it doesn't matter how many times you see that patient, because it's all kind of fixed. Everything is fixed. And so then it comes back to triple aim, quadruple aim, however many, quintuple aim, right? It comes back to those things. And so there is a danger. And I guess I could say in our system today, in the way that we do healthcare today, there is a bit of a danger, I suppose, in maybe having some resistance from physicians, for certain types of physicians, right? Until you move into that value-based model.
When I think back to the conversation you and I had a couple of years ago, and I asked myself, why has not much changed for the good since then? We've seen American life expectancy stay the same. In fact, it's less now than it was when we talked. It's no better than it was in 2010.
Right.
Watching over half of the nation find healthcare unaffordable, even though they're insured. This is the out-of-pocket costs. We know there's 400,000 misdiagnoses leading to deaths every year, 400,000 more leading to patients who are permanently maimed as a consequence, 250,000 people with death from preventable medical errors. I mean, as I said earlier, 60% of physicians being dissatisfied, burned out, 70% of patients saying the system is completely broken. I mean, you would think that there would be a rapid evolution. And
Right.
when I look at the history, as I say, this notion of moving from fee-for-service to capitation, from individual clinicians to groups working together, collaborating, cooperating, you can trace it back to 1932, to the CCMC, to the Committee for the Control of Medical Costs. And I asked myself, and a lot of the driver of the book, I asked myself, why is change so hard? Now, people say, change is hard. Well, yeah, I think change is hard when it's difficult to accomplish. And when I look at it all, I used to think that if you could explain to people why something would be better, why something should happen, must happen, it would happen. And I don't think it anymore. I think it happens when people run out of other options. And I think that's where we are right now. I think there's not a solution out there. And the reverse side is there wasn't a tool until generative AI. That's what really woke me up, because I've never been a big proponent of AI. I could see all of its flaws, all the problems with the data not being clean enough. And people had a hope. Watson was an example that somehow they could put all this data off the electronic health record and they could develop ways of being able to do what generative AI does, which is advise patients. And I said, no, they won't, because the data is not clean. You got to put clean data in place to make it usable. And we didn't have that. And so I would say the last time we spoke, capitation is a direction I thought we should go. But if you had said to me, Robbie, what tool do we have that allows us to have higher quality, better service, and lower costs and greater satisfaction? I couldn't name one, because all the tools that exist were driven to raise costs and drive up profits in a corporate world. Now we have one. And we have one that is aimed at the patient. And I want to add another piece, which is the regulatory piece, which is that all the tools of the past had to go through the FDA. What's different about a generative AI tool is it's not specific to healthcare. It's like a telephone. Now, you can call up your friend and get medical advice, and you may get good advice or bad advice, but there's no way the telephone company can regulate what your friend says to you about the problem you have.
Right.
It's true with generative AI, although here, rather than being your friend who doesn't have medical expertise, it has access to all of the textbooks and the journal articles and the material published, and increasingly over time, more and more coming out of the clinical sphere. So that's what I think is really different, John. We now have the tool, which is why I think people will start to accept it, and we've reached the end of the road. I don't see any way, from every piece of data and article that I read, that the future for clinicians or patients is going to be any better than today. And I can give you a lot of reasons why it's going to continue to go downhill.
Yeah, I mean, it's almost like the new way, just compared to, say, the early days of Watson. It's almost like this process, this model, this large language approach. Again, the nitty gritty behind how it works, I'm not versed in that, but it's almost like it's able to filter out the bad stuff, because you're always dealing with dirty data, right? And it's almost like it can discern and give you the right results, or it does its best job to give you the right results and filter out the noise or the incorrect information. And hey, our experiment that we did here with the most recent version of Chat GPT is part of what my company does is we profile these large health systems. So we went in and let, with a series of commands, let Chat GPT tell us what Advocate Aurora whatever I guess they're advocate healthcare these days, but to kind of use the tool to profile. And it was amazing the accuracy of some of the information that was about facts. How many people do they see every year? How many physicians on staff, or how many employees they have, or their revenue levels, right? But when it came to the more interpretive questions that it's market research. So this isn't healthcare, but it's about a healthcare organization. As we started diving into the more interpretive things of understanding what Advocate was all about, that's when we started getting, it's not that we weren't getting results. That's where we were getting results that, quite frankly, we didn't agree with. I went back and I looked, I wasn't part of this exercise, but I went back and I looked at the transcripts. That's exactly what happened. But then it's just a matter of time, right? Next version gets better. Version after that, to your point earlier, it's just going to get better and better. And it sounds like at the rate maybe even faster than Moore's law, right, with chips. So I don't know, maybe I'm going to be out of business in a few years, but I do think about that. I do think about what is the role. But one of the things that I wanted to ask about, before we're about ready to wrap up, but what, beyond the things that we're talking about, if you think about a system and all the different ways that data is used, or data are used within a system and patients interacting, can you think of just looking out sort of 5 years, like which ways that, and again, generically Chat GPT, but these other tools too, that generative AI is going to be in finance, in pop health management, like all the different applications. And I'm sure this is in your book too. You probably talk about it. I can't wait to read it. But what other ways, other than what we've been talking about, kind of the common sense ways that you see these kinds of technologies being deployed?
So a couple of things. First, for listeners and viewers, I want them to know that all profits from the book go to Doctors Without Borders. So even though I'm promoting it, I don't have any personal gain financially as a consequence of that. And if they want more information, they go to my website, robertpearlmd.com. But to answer your question, I think this tool is going to impact every part of our life. I make the analogy to the iPhone. Tell me a part of your life that you don't ever touch with the iPhone, whether it's retail, whether it's entertainment, whether it's travel, whether it's finance, whether it's your friends, social media. You go down the list and it impacts everything, which doesn't mean that it impacts everything equally as well. But the reason it does it better or worse, to the point that you're making, is how the underlying application works. So in the book, I go into great detail about the different kinds of AI. As I said earlier, this narrow AI is dependent upon the data sets that you present to it. And if the data sets are biased, or if the data sets are inaccurate, then a narrow-based AI tool is going to fail. And that's been much of the history of the AI-based tools when it comes to healthcare. The generative AI is completely different. I like Chat GPT. First, it rolls off the tongue, but second, because the GPT really should be PTG, is what it does. It's pre-trained on the totality of information, and that in quotes, because it can never be everything because they can't access it, but the totality that exists, the internet, the journals, the textbooks, as I said, soon the conferences, soon looking at video of doctors working and learning from that, opportunities to continually learn. The more information, the better it's going to be. Then it's it's transformed. This is through what's called parameters. So these are the rules. There are billions of them. You want to have a journal article that's more recent versus one that's older. One from a peer-reviewed journal versus one that's from not peer-reviewed. One from the Mayo Clinic, not from some place that's not reputable that you don't know about. And then, as you say, as a large language model, it's then able to use these parameters to take all the data to generate an answer to every information. So, long answer to your question of how will it be used, it's going to depend upon the information available. Why you had the experience is that the data that it was great at is where there was data. They have to report the number of patients seen, and they have to report the clinical outcomes to state and national regulators that you follow very closely. It has to
Right.
provide information on costs, and it can research all of that in a matter of fractions of seconds and give you, what would take a researcher that you employed a long time to accomplish. Where it's not going to be good are some of the things where the data is hidden. If you want to know, for instance, about medical errors, you might not find that data because it's not well published, or costs because that data, theoretically it's regulated and should be and is demanded to be, but you know very well it's hard to find. And that's where a human with a certain degree of skepticism is able to come to better answers, and why you and your colleagues will always have a great job, because you'll then take the information and you'll know where ChatGPT, not that the technology failed, but that the technology didn't have the information that it needed. We know that it's going to do a variety of positive things. We know it's already entering information into the electronic health record and saving clinicians from typing and allowing them to make eye contact with the patient rather than staring at the screen for the entire relatively short visit that unfortunately is often the case today because of the time pressures being brought. It's going to allow them, as long as we stay in a transactional fee-for-service, the battles between insurers and clinicians. No, this is not covered. Yes, I should be covered. But we said it's not covered. You got to submit 3 more reports. But I've already submitted 4 reports, and on. It goes constantly there. It will facilitate that. But I think all of that is, I'll say, somewhat outside the scheme of what I think is the real opportunity, which is this notion of focusing on health. And
Sure.
we have lost that. Nowhere in the health system do we emphasize sufficiently that the best way to save lives, to raise quality, to lower cost is by preventing disease in the first place, by managing chronic disease and avoiding its complications, by not making medical errors, by avoiding misdiagnoses. I go on the list of pieces that are there. And this is exactly what this technology is designed to do, assuming that both doctors and patients allow it to and learn from it. I'd say to the listeners, this is my big message. This is the time to experiment with it. I was on a podcast earlier this week, and at the end of the show, I was chatting with the podcast host, and she said to me, I hate to say this, Dr. Pro, but you're a clinician, you're a skier. Can I just get your opinion? My husband was skiing 2 months ago. He took this fall with his arm outstretched, and since then he hasn't been able to do much with the arm. What do you think's going on? And, as a skier, as a doctor, I knew exactly what was going on. But I said, I want to do a little experiment with you. Put all the information into Chat GPT. And she had never used it before. And as much as you can do, and see what comes out. And then give me an email, and I'll tell you whether I got it right or wrong and what you should do, because I'm pretty sure I know what's going on. And she called me back in 3 days, and she said, it's amazing. Number 1, it made the right diagnosis. Number 2, it suggested the right diagnostic test that was needed. But number 3, it said most likely he needs surgery. We contacted the orthopedic surgeon, who confirmed everything that ChatGPT had said and has scheduled him for surgery. He would have been in a situation where by the time they operated, it would have been too late. This has saved his arm. Anecdotal, yes. But I've now heard similar stories from lots of clinicians who are saying, again, with the current version, they're not going to rely on it as the sole answer, but they've taken what patients could have entered into this system, seen the answers, and they've said, this aligns with exactly what I either told the patient or would have told the patient. And it was interesting, when I was writing the book, I heard from people who said, Dr. Pearl, I know you're writing this book on generative AI, ChatGPT, MD, because I included it in my monthly newsletter that I was doing it. And you probably don't know how effective and reliable it is. And of course, I had done the similar experiment, so I had a sense, but I thanked them anyway. The point being, even what exists right now is remarkable. And now is the time for the patient to be experimenting with it, using it as a background, using it before or after they go to the clinician for understanding. Now is the time for doctors and medical societies to start realizing that they're going to have to train patients. It takes about 10 hours to fully learn how to maximize the use of the information. And then I think over the course of the next year or two, as the technology gets better, to start applying it first in those situations with minimal risk, and then increasingly with more severity. We need to do the science to verify everything. I'm not telling anyone that 100% guarantee this is going to change American medicine, because that is not known. It's going to depend upon whether we use
Sure.
it. What I will tell people is it has the potential to radically transform American medicine, to increase life expectancy, to minimize complications and risks, to improve convenience, and to lower costs. And if we could accomplish that, that would be a remarkable advance, and it would make American medicine once again the best in the world.
It's fascinating. I'm really, really interested to see where all of this goes. If we were doing one of those podcasts where they make money off it and you have to charge for it, I'd say this is a bonus question, but we don't make money off of this. We don't charge for it. But I did want to get your assessment. So hang with me for one more question, please. And it goes back to something that you wrote a while ago on the Kaiser Geisinger merger with Verizon. And I just wanted to get sort of your assessment of where, because it shocked me when I saw it. I tried to make sense of it, and I think I've written about it, but the cultures are different. There's a lot of differences in the two organizations. There's also a lot of similarities, but I wanted to get your read on that. And obviously you don't speak for Kaiser in any way, that's in the past, but just kind of what your sense is where we're headed with this and what may be on the Kaiser folks' mind.
Well, I have written extensively about it at the time when the announcement was made. As I say, through my on my homepage, people can find the information, robertpearlmd.com. I encouraged, and again, as you say, I'm no longer inside the organization, so I have no inside knowledge. Everything I'm telling you is what I read in the same media and press that everyone can. I think there was a major error in the announcement that was made, at least, that the opportunity should have involved the medical group. This was led predominantly by the insurance part. And I don't think the insurance is the big issue in American medicine today. It is very central. It's certainly the largest financial part of it. But it really comes down to the care delivery. And the care delivery in Kaiser Permanente is the Permanente half of Kaiser Permanente, which is the clinicians, the offices, the
Right.
direct care provided in the hospital by the doctors, and the tools that are there. And I think that that's where the real expertise is derived from, and that was not involved in the original announcement. So from that standpoint, I'm hoping that is going to change. I think what you're seeing is a certain frustration that across the United States today, value-based care just isn't happening. We continue to do the system of the past. And I want to tell listeners, the estimates of the federal government are healthcare costs are going to go up. You ready? $3 trillion a year by 2031. That's only 7 years away. $3 trillion every year.
It's not tenable.
It's not tenable. And do we really think the best use of $3 trillion is to keep getting the same healthcare of today? No. I think that radical improvement is necessary. I think up to this point, we've debated it. And I think generative AI is a powerful tool. I put that together with a change in reimbursement, the move from fee-for-service to capitation, the move from thinking we can provide the best care by single individuals to recognizing it requires teams, that chronic disease requires clinicians from 4, 5, 6 different specialties. I think we need to use technology, and I'll add, it requires a level of leadership that doesn't exist currently. The fifth and final part of Chat GPT MD is all about the leadership improvements and changes that are going to be necessary. I think that with them, we can make the progress. And so I'd say that right now, Risent and Geisinger, it's a work in progress. It's going to require leadership. It's going to require expertise from the medical group. I think it's going to require a shift in the underlying economics. They have some big challenges from systems around them that you know well, out of Philadelphia and out of Pittsburgh.
Yep.
And I think it's a story that will need to evolve over time. But as you know, right now it's been approved, so it's now official. And so you and I can follow it together and maybe come back together in a few years on the show and have a retrospective view of all that may have happened.
That would be great, and I appreciate the nod around Chat GPT that hopefully I'll still have a job in a few years. The analysis side of things. So just as a reminder to everybody, I know that you said it before, Dr. Pearl, and again, thank you for taking time with me. But I really appreciate your insights. Your writing, I'm going to take a little bit, do an unsolicited commercial. Your writing is excellent. I read about half of or 3/4 of your first book and almost all of Mistreated. You're a very good writer. It's very entertaining, although what you're talking about is very serious. So I can't wait to get my hands on ChatGPT. Where can people, just remind again where people can find you and find the book, and then we'll wrap it up.
They can find me at robertpearlmd.com, and they can get the book on Amazon. If they're a Prime member, they can get it very quickly. And the book is ChatGPT MD. If they put ChatGPT MD, Robert Pearl, it'll pop up right away. And right now, it's number one on Amazon's new best books list. And hopefully, it will stay there with all profits going to Doctors Without Borders. So you and I together, hopefully, can help improve American medicine. And neither of us benefit financially as a consequence, but it's the right thing to do. It's mission and purpose, and it's very fulfilling.
Well put. Again, well, thanks, Dr. Pearl. It's a pleasure to see you. Appreciate your insights, and we'll just hopefully we can make this a more regular thing. So again, thank you so much.
Thank you, John. My pleasure.
Well, that's it for another episode of Healthcare Rounds. Thanks for listening. Of course, our guest today was Dr. Robert Pearl. As always, I'm your host, John Marchica, CEO of Darwin Research Group. And listen, do us a favor, leave us a rating on Apple, Spotify, or wherever you listen to the show, because when you rate and review us, it helps other like-minded people find Healthcare Rounds. And of course, if you haven't already, be sure to follow us on LinkedIn and YouTube. So that's it. See you next week, or in the next maybe 2 weeks when we have our next one. Again, thanks for being here. Take care.